We now welcome Dr. Yasmin Nasir Ajanah, Course Director for Sport and Exercise Medicine courses. Thank you so much for joining me. So, the University of Nottingham offers two MSc programmes in this field. You've got Sport and Exercise Medicine and Applied Sport and Exercise Medicine. So could you explain the key differences between the two and which students might be suited to which course?
Absolutely. The sports and exercise medicine courses are designed, so the SEM course is designed for people who have an existing clinical background, such as your doctors, your physiotherapists, your sports rehabbers, and want to deepen their skills and advance their knowledge and experience in sports and exercise medicine, whereas the applied course is suited to individuals without an existing clinical background. So we're speaking about your epidemiologist, your human biologist, your public health specialists that are interested in developing those skills and acquiring those knowledge in sporting injuries and understanding how to assess and manage these injuries within the sporting context and increase their career prospects of working in the sporting environment and beyond.
And are there any core or specialist modules that really define each course and help, shape that student experience?
There is a variety of core modules within the sports and exercise and applied sports and exercise programs. For example, we have the team medicine module that offers the experience of for students to have that pitch side experience where they get to witness injuries as they occur, manage them, understand what pre-hospital arrangements need to be made, how to design an emergency action plan, how to check that the equipments are available, what multidisciplinary healthcare team members are present within the environment before a game even begins, and how to correctly and in a structured fashion manage pitch side injuries as they occur on the pitch side. So we do have the team medicine module. Students also get to undertake the sports injury assessment module that provides them advanced knowledge and skill in assessing sporting injuries and beyond. Students get to take the theoretical foundations and rehab module that deepens their ability to have complex communication with patients, particularly those that struggle with more complex issues. And it does so by drawing on key theoretical models. Students get to go on placements, a variety of placement opportunities within the team medicine module and the MSK health module. The wilderness and expedition medicine module offers students the opportunity to go on expedition trips, whereas some of the placement the students have gone on in the past include professional placements with the Nottingham Forest Football Club, professional placements with the Birmingham Ballet, Cambridge Rugby, Nottingham Panthers Ice Hockey, and the list goes on. And students also get to take part in university placements with the box and IMS teams, and they get to learn specialized skills and training in taping and massage and cover real life events. So students have that opportunity in modules such as the team medicine, the module. We also have the sports and exercise nutrition, where students are able to assess different sport athletes in different sports, identify what their nutritional needs are, and design tailored, specialized nutritional plans for different athletes. So we do have a variety of modules that really provide students with core essential knowledge and tailored skills to advance their abilities within the sporting context and even beyond. So in terms of the physical activity in health and diseases module, students have the ability to not only look into the sports world, but also find out how physical activity can be used in disease management and prevention for the general public as well. And so there's that variety within the course.
So how involved do students get, when they're doing these practical modules and going out and getting that real world experience? Is it something they really get to, be involved with?
Yes, absolutely. So students are very well drawn and involved into the practical element of their pitch side skills. So for example, they do take a sports trauma course right from the start of the course that trains them with the practical skills of managing injuries as they occur on the pitch side, making crucial decisions of whether to allow a player to play on or if to sit the player out. Because we do know quite commonly players love to play, especially if they're working in, say, an elite setting and they do not want to lose that opportunity. They want to keep playing. And so a player will be severely injured and the physio or the healthcare practitioner will approach them and they'll tell you, no, I'm fine. But the truth is they're not fine. And so it's helping students to know when to assess such situations, make the quick decision and be able to assess a player as well as the environment and apply those skills in managing different types of injuries as they occur. So students really do have the opportunity to get hands-on with managing a variety of injuries. You have your concussions, fractures, anything from sprains and strains to your more complex sudden cardiac arrest. And so it's really teaching them what to do and how to approach these situations if they do occur.
And where are some of the places that your recent graduates have gone on to work? Is it that there's, certain specialisms that they can go on and get involved with?
Yes, our recent graduates have gone on to work in various settings, such as with professional clubs. So we do have graduates who currently work with a variety of professional sports clubs, but we also have our recent graduates who work in the private setting, own their own business in terms of sports clinics. And we have students who work within the NHS setting in terms of that clinical scenario, and students who go on to pursuing a PhD and working within the research environment. We have students who also work in academia. So the opportunities out there are within and beyond the sporting context.
And what is it about the University of Nottingham that you would say is such a leader in this course and field?
The University of Nottingham is a Russell Group top university when it comes to sports and exercise medicine. We've won the Sports University of the Year award twice, and we are the leading university when it comes to sports and exercise medicine. We offer students a variety of opportunities. Students not only get to have the theoretical knowledge of sporting injuries, but they get to attend a variety of real-life events and opportunities that expose them to environments where they will come across these cases and manage these conditions and represent that sporting community in an effective and efficient manner.
Well, thank you so much for joining me today.